Overnight, up to 8 p.m. last night, we had 6 new cases that were locally transmitted, and that's certainly better than it was yesterday. But we also had 5 new cases that are in hotel quarantine, so a total of 11 cases to 8 p.m. last night. Testing remains a concern because yesterday when I stood before you with Dr. Chant, we had 16,021 tests, and we were concerned about that. Well, we're even more concerned today because it's dropped below the 16,000. It's down to 15,802 tests. So I just want to say again, to try and manage COVID-19 on behalf of our community, we really do need the entire community to be with us on this journey. COVID-19 is still amongst us. If you have any sniffles at all, a sore throat, a tiny scratchy throat, any symptoms at all, you must, for your sake, for the community's sake, go and get tested. We're aiming to have at least 20,000 a day, and while we have these positive cases still amongst us and actually being seen as amongst us, the emphasis that Dr. Chant and I have is to please get tested. 3 of the new locally acquired cases, so as I said we had 6, but 3 of those 6 are very clearly connected to the GP practice in Holden Street, Lakemba. Again, obviously the numbers have increased, but that's exactly what we anticipated because of the nature of the GP practice and the fact that GPs were involved. So we are still alert to more cases that may come from that practice. And again, I say to people who have been to that practice, be alert to any symptoms whatsoever, and if you have family members, make sure that your family members are also alert, because the nature of this particular virus is that you may have it, but you may not realise you have it, but your family members could actually have it transferred to them from you, and they could have symptoms. So please make sure that if you have been to that practice in Holden Street, you are very careful. One of the 6 is a household contact. You remember yesterday we said there was a case of a gentleman, I think in his 70s, from Bargo. Well, one of those cases, one of the new cases, is actually from household contact of that gentleman in Bargo. There are 2 other cases still under investigation, and I'll ask Dr. Chant to actually perhaps address that in detail, along with a number of other cases that we need to look at, and particularly the chain of transmission. Can I say this? One of the ongoing problems that we've had, that health has had here, public health has had in New South Wales, but also in Victoria, is that people are not necessarily telling us the whole truth and nothing but the truth. Public health only has one interest, and that is making sure that you remain healthy, but also that the community maintains its health and the fight against COVID-19. We've had a case overnight in Victoria where there is some indication that a gentleman who is involved in driving trucks and involved in the tyre industry may not have actually expanded fulsomely on where he had been, and as a result we now have concerns in Shepparton, which is within the New South Wales Victorian bubble, and as a result of that, in his initial investigations the reports seem to indicate that he didn't actually advise that he had been to Shepparton. Whether it's deliberate, whether it's just simply overlooked, you need to make sure that it's neither of those things. You need to make sure that you tell the whole truth and nothing but the truth, and be very careful in what you're telling public health officials. The public health officials need to be able to track the chains of transmission. That's impossible if people don't actually give us the fulsome information on where they've been. The result of that gentleman in Shepparton, and the fact that Shepparton is now in the bubble, or has been in the bubble, Victoria New South Wales bubble, means that we are now on very high alert in that area around our southern border. We've had to give special warnings to aged care facilities in terms of people visiting again, and put in special protections put on high alert our health facilities. Obviously nobody will be stopped from going to our health facilities, but it means a lot more caution. It just makes sense We are not interested in any of your personal activities. We are not interested in other legal issues that you might have been involved in. We just need you, public health needs you to tell us the whole truth and nothing but the truth.